This is a newer tablet medicine for type 2 diabetes that helps lower blood sugar in a different way from older tablets. It is already approved and used in Japan under the brand name Twymeg, and research shows it can lower long-term blood sugar and may be safe even in people with kidney problems when used correctly. Let us talk about what this is, how it works, what research says about its benefits, and what you still need to watch out for. Imeglimin is an oral medicine, which means it is a tablet you swallow with water. Is it better than the currently approved and widely available medication called SGLT2 class? The common SGLT2 drug, like Jardiance or empagliflozin. It is used for adults with type 2 diabetes. In Japan, it was approved in June 2021 and is sold under the name Twymeg. One large program called the TIMES trials looked at more than 1,100 people with type 2 diabetes to check both safety and how well it lowers blood sugar. These trials helped get approval in Japan and showed that Imeglimin can help people whose blood sugar is not well controlled with diet, exercise, or other tablets. Imeglimin works in a special way inside the body. It works on the tiny power plants inside cells, called mitochondria, and helps them use energy better, so the body can handle sugar more smoothly. It helps the pancreas release more insulin when sugar is high. It also helps the body use insulin better and may reduce how much new sugar the liver makes. This two-way support, helping both insulin release and insulin action, is why some experts call it a first-in-class drug, meaning it is the first of its type. Now, what about the numbers? In one phase 3 trial in Japan, when people took Imeglimin by itself, their HbA1c, which is the 3-month average blood sugar, fell by about 0.46 percentage points after 52 weeks. For example, someone might go from 7.6% to about 7.1%. In other research, when Imeglimin was added to another diabetes tablet called a DPP-4 inhibitor, HbA1c dropped by about 1.0 percentage point in 16 weeks, from 7.5% to 6.5% on average. In another group of mainly Caucasian patients, combining Imeglimin with sitagliptin lowered HbA1c by about 0.72 percentage points in 12 weeks. These numbers may sound small, but even a 0.5 to 1.0% drop in HbA1c can clearly cut the risk of eye, kidney, and nerve problems over time. Blood sugar over the day also improved. When Imeglimin was added to DPP-4 inhibitors, and people wore continuous glucose monitors, time in range, meaning the time blood sugar stayed in a healthy band, went up, and time above range went down. Just to clarify, time on range and time above range is a new measure, better than HbA1c. Diabetes. Time in range, TIR, is the percentage of time blood glucose levels stay within a target range, usually between 3.9 and 10.0 mmol/L, or 70 and 180 mg/dL. It is measured by a continuous glucose monitor, CGM, offering a dynamic view beyond A1C. Goals typically over 70% TIR, about 17 hours day, to reduce diabetes complications. Key metrics also include time below range, TBR, and time above range, TAR, to understand lows and highs, helping personalize treatment plans for better control. This means fewer hours each day with high sugar levels and fewer hypoglycemia events, which is good for long-term health and how people feel day to day. One interesting point about Imeglimin is that the fall in HbA1c is not instant. In the big Japanese phase 3 trials, HbA1c dropped slowly and reached a stable level at around 20 to 24 weeks. So people may need some patience, because the full effect may take about 5 to 6 months. Some research also suggests that HbA1c might fall a bit more slowly than another lab marker called glycoalbumin, which measures shorter-term sugar. This might be due to how imeglimin affects red blood cells and their lifespan, but this idea is still being explored. What about kidney function? Many people with type 2 diabetes also have kidney problems, so this is important. Imeglimin is cleared by the kidneys, so doctors were careful at first about using it in people with lower kidney function. But newer research and real-world data have been encouraging. One report in Japan looked at patients with moderate to severe kidney problems, with eGFR below 45 milliliters per minute per 1.73 square meters, and followed them for about 3 months after starting Imeglimin. There was no clear worsening in kidney function or liver function, and no serious side effects like acidosis were seen in that short-term follow-up. Protein in the urine, which is a sign of kidney stress, even went down significantly in that group. Because of such data, in 2025, Japanese regulators allowed the TWYMEEG label to be updated so doctors can use Imeglimin in patients with moderate to severe kidney impairment. A Phase 4 trial called TWINKLE helped support this change. A new patent in Japan and China now protects the use of Imeglimin in people with kidney problems until 2039, which suggests it may become an important option in this group. But people with kidney disease still need careful dose and regular checking because the drug stays longer in the body when kidneys are weak. There is also interest in how Imeglimin might help the heart and blood vessels. Animal research in diabetic rats showed that 90 days of Imeglimin treatment cut harmful molecules called reactive oxygen species in the heart, improved how the left side of the heart pumped, and reduced kidney scarring and protein in the urine. This suggests possible protection for the heart and kidneys over time. In humans, a small real-world study found that while blood sugar improved, there were still some major heart events, like heart failure hospital stays and bypass surgery, in about 14% of high-risk patients, so it is not a magic shield. But it did not seem to cause clear harm to the heart in that group. Now, people always ask, what about side effects? Overall, Imeglimin has been described as fairly well tolerated. In several trials, there was no clear rise in low blood sugar when it was used without insulin or sulfonylurea tablets. Common stomach issues like nausea or diarrhea were not seen much in some kidney studies, though earlier trials did note that mild stomach upset can occur, as with many diabetes tablets. Safety data over longer periods are still growing, especially in people with very low kidney function or complex heart disease, so doctors usually start carefully, watch blood and kidney tests, and adjust or stop if needed. Another common question is Imeglimin available everywhere? Right now, Japan is the main country where it is fully approved and sold as TWYMEEG for type 2 diabetes. The company that helped develop it is working with partners and regulators to bring it to other regions, including parts of Asia and maybe beyond. But this process takes time. That means if you live outside Japan, you might hear about Imeglimin in news or research articles, but you may not yet see it in your local pharmacy. So, who might be a good candidate for Imeglimin? Adults with type 2 diabetes who still have high blood sugar even after lifestyle changes and other tablets are possible candidates, especially if they cannot tolerate some older drugs. People who already use a DPP-4 inhibitor and need extra help might see a bigger drop in HbA1c when Imeglimin is added, based on the 1 percentage point reduction seen in Japanese research. People with kidney problems who cannot use some other options may also benefit now that there is approval to use it in moderate to severe kidney impairment in Japan. But every case is different, and doctors need to tailor treatment. It is also important to be realistic. Imeglimin is not a cure. It is one more tool for managing type 2 diabetes. The average HbA1c drop in big trials, around 0.4 to 0.7 percentage points when used alone, is helpful but not huge. For some people, it may be enough to reach their target when combined with food changes, movement, and other tablets. For others with very high HbA1c, stronger drugs or insulin may still be needed. but having a new option that works in a fresh way can help doctors build a plan that fits each person better. If you already have type 2 diabetes and heard about Imeglimin online, the safest move is to talk with your own healthcare team. Ask them simple questions like, is this drug available in my country? Would it work for my blood sugar pattern? And is it safe with my kidney and heart health? Bring up anything that worries you, like past side effects with other tablets. Good care is about teamwork between you and your health staff, and new drugs like Imeglimin are just one part of that bigger picture. So, Imeglimin offers a new way to help control blood sugar, with research showing moderate drops in HbA1c, better time in range, and possible kidney and heart benefits, especially in Japanese patients with type 2 diabetes. But it still needs careful use, especially in people with kidney or heart issues, and it may not yet be easy to get in every country. Click the like button and subscribe to my channel. It is a simple help to me encourage to make more videos. Thanks.